Hello, my name is Guglielmo Schina and I'm the head of the Global Section for Mental Health, Psychosocial Response and Intercultural Communication of the International Organization for Migration. I'm very pleased to welcome you to the online course on community-based mental health and psychosocial support in emergency and displacement. This course is addressed to program managers and technical supervisors of mental health and psychosocial support programs in humanitarian settings, either working for IM or other organizations, which aim to adopt a community-based approach to the design, implementation, and monitoring and evaluation of their programs for disaster-stricken or displaced populations. This course can be of interest also for MHPSS practitioners and experts that work in humanitarian settings with displaced population, who do not have managerial functions. Yet, its focus is on the management of processes related to a community-based MHPSS program, and not on the technical aspects of each component of the programs. I make an example to clarify this concept better. The counseling model, by instance, does not give hints to counselors on how to provide better counseling, or teach people who are not counselors how to become a counselor. It teaches managers on how to integrate counseling in their program, how to do it in a community-based fashion, and how to select the best counseling methods to mainstream in a specific program or a specific context. The same applies more or less to all modules, so that's how you have to approach this course. In the last years, a need has emerged among experts, practitioners and humanitarians to build capacity and awareness on community-based mental health and psychosocial support practices and processes in emergencies, and especially in those emergencies leading to displacement. This course was developed within this context, with the aim of harmonizing community-based approaches to MHPSS and creating a tool that could facilitate programming in different settings and could be used by MHPSS professionals consistently in different emergencies. Therefore, the training focuses on three axes. The first axis is the management of MHPSS programs, and therefore how to access needs and map resources to mobilize, design programs, hire teams and mobilize communities, understand and operationalize some of the activities that constitute a psychosocial support program, monitor and evaluate them, and also how to interact with other sectors and build community and staff capacity. The second axis is the one of a community-based approach to MHPSS, which is an approach that respects the agency of individuals and communities and that understands that people can be drivers of their own care and change and should be meaningfully involved in all stages of MHPSS responses. The third axis is the one of displacement. Displacement and displaced population, especially those affected by crisis, might not be able to realize their full potential due to the lack of access to opportunities and to meeting basic needs, and to experience abnormal stressor. Migration and displacement are complicating community dynamics and the ability to make one contribution. So we have to understand these nuances when working with communities that are affected by displacement. In order to complete this training, you will need to complete 10 modules, which consist of a combination of videos, readings, reflection exercises, writing assignments, and short quizzes. A module on the main concepts and models of work that inform community-based MHPSS programming will be at the start of the course. A module on how to engage communities in an MHPSS program, which is the other core element of this course, will close the training. A series of modules in between will look at more operational aspects and processes like how to do assessment and mapping, how to create and make operational psychosocial mobile teams, how to facilitate community support activities, including social relational and cultural activities, creative and art-based activities, rituals, celebrations, sport, play, and non-formal education and informal learning. A module on how to integrate counseling in a community-based MHPSS program will be part of this group, as well as a module on how to provide MHPSS for people with mental disorders. Our last module in this group will be dedicated on how to integrate MHPSS with livelihood support and protections. Then there will be another set of modules that have more to do with management, as monitoring and evaluation, technical supervision and training, and one stressing the importance of coordination with other providers. It is important that you follow the modules in the given order, and within the modules you watch your videos, do your readings and your quizzes in the given order. This is because some of the info contained in a prior element of the course can be necessary to understand the following ones. The course is self-paced. We plan for it to take up to 30 hours to complete, yet it is up to you and your pace how long this course will ultimately take in your case. Since the course is self-paced, there won't be a direct interaction between us, but you can always reach us at contactpss@iom.int if you need additional info, clarification, you have questions or whatever. You will receive a certificate of completion at the end of the course. This course is based on the Manual on Committee-Based Mental Health and Psychosocial Support in Emergencies and Displacement, which was published by IOM in 2019 and updated in its last version in March 2021. We will refer you back to the manual in each module of the training. Over the course of 3.5 years, 29 authors, 130 expert reviewers from UN agencies, international organizations, NGOs, academia and donor groups, more than 200 practitioners and scholars around the world provided feedback. All of them have contributed to the development of the manual and therefore to the contents of this course. Let me acknowledge here at least the main authors. You will see them in the screen now. And the reviewers that were a part of the steering committee that appear on screen now. The manual is available online and in print and consists of 16 chapters, 3 annexes, an extensive bibliography, 2 accompanying explanatory videos and over 200 hyperlinked tools, articles and technical websites. In this sense, the online course is a very synthetic version of the material contained in the manual, and we encourage you to read it in addition as a companion to the course. I especially encourage you to read the chapters that correspond to each module of the course, because you will find there much more detailed information. This online training will be delivered by over 20 MHPSS managers, team leaders, practitioners and experts from different agencies and NGOs, local organizations, academia, and from different countries, who are either co-authors or reviewers of the respective chapters, or who have used the manual to implement their programs since 2019. I will also present part of the contents, and I was also an editor and an author of the manual. I want to thank a lot the Office of US Foreign Disaster Assistance, OFDA, for funding this initiative, the Interagency Standing Committee Thematic Working Group on Committee-Based Approaches to MHPSS, who provided their support throughout the development of the manual and its feedback processes, and to the International Federation of Red Cross and Red Crescent Societies, the International Medical Corps, the International Trauma Studies Center, Mercy Corps, the Psychosocial Services and Training Institute, PSTIC, in Cairo, Terre des Hommes, the United Nations International Children Emergency Fund, UNICEF, so-called UNICEF, for their contribution to the course. This course was developed during the COVID-19 pandemic and the response to it. This is evident in many details, including the quality of the videos that we took when we could and where we could, looking at a camera and a laptop, putting together homemade videos in empty office spaces or in our kitchen, and so on. We apologize for that, but we know that you can relate to this new fashion of work. We would not have done an online course if it was not for the pandemic, because we believe that psychosocial support stems from a relation between bodies, by committee gatherings in a space and time, and face-to-face dialogue. This training cannot happen in absence of all these elements. We are adapting, hoping to go back to face-to-face trainings as soon as possible. On the other hand, we can't and should not ignore the pandemic either. Although this course does not explicitly focus on the provision of MHPSS during a pandemic, you can refer to this guide appearing on screen to complement and adapt the content of the course to a situation of pandemic within IOM programs. To this link, to look at what the Interagency Standing Committee has developed in this sphere, but also many other agencies, and to our online course on MHPSS at times of COVID, you find in this same platform. I hope you enjoy this training and that you gain valuable insights on committee-based approaches to providing MHPSS from the many colleagues who collaborated with us to make the course possible. Thank you for your interest, and I wish you all the best in your training experience.